Welcome, everybody. It's the Radio Surgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hello, good morning. Good morning, John. How are you?
Good morning, Dr. Lederman. Doing well. How about you?
John is my co-host today, and Coop is running the show in the control panel in the control studio, so he's ready to take your calls. We're live.
That's right.
Not like those other guys. We're live. We're here. We're sitting a few blocks from our office, so I can go to my office, get my papers, and walk over here, and that's exactly what I do every week. Our number is 800-848-WABC, which is 800-848-9222. 800-848-9222. We're live if you have questions about cancer treatment, cancer news. There's a lot of interesting news this week, actually more than the show will hold, and we're trying to get through as much as we can. The American meetings in New York, the Rankin Society, were held this week, were updated cancer treatment. So we're going to talk a little bit about some updates later in the hour. We're going to talk about some interesting patients. I had a fascinating patient this week. I had actually multiple fascinating patients for me. Patients are incredible, and I sit with them. It's not my nurse or my student or something else. I take the phone calls afterwards.
Sure.
I take the phone calls at nights and weekends. And I have a friend who's he's a big physician. Actually, he's at one of the hospitals in New York, and he's been sick, and he's been going to a big cancer hospital not far away. We won't name names. And he said, Doc, to the guy in the cancer hospital, if I get sick, can I just have your cell phone number in case I get sick at night or weekend so I can speak to you or ask questions?
Yeah, that's, I would hope so.
And it was a big professor.
Yeah.
One guy was a big professor, the other guy was a big professor. So the big cancer doctor told him, who's a big other doctor at a big medical center in Manhattan, no.
Wow, really?
And I was shocked. Honestly, I was shocked because they've known each other for 5 years. They've established a relationship.
I was going to say the relationship is almost outside of their professional relationship.
Yeah, and he said it was so cruel.
Yeah, sure.
He said, if I give you my phone number, then I'll have no time to do my work. And I was thinking, well, what's the doctor's work to do?
Right. What is your work then? Yeah.
The doctor's work is to take care of the patient,
sure.
right? And this man had a terrible complication from chemotherapy. He had chemotherapy on a Thursday night, and 24 hours later he got septic. Septic is when you have an overwhelming infection.
Okay.
And he had fevers to 105 degrees, and he was shaking, and he couldn't get a hold of the doctor. And he ended up going to the emergency room, and he got twisted around, and finally they were going to send him home, and then they realized he was septic, and he nearly died. He was in the hospital for more than a week. Wow. And lost consciousness. And he was a big doctor.
Yeah,
he lost consciousness. He was almost dying, hypotensive. And throughout that period, the doctor wouldn't speak to him on the phone and actually didn't even come to visit. So it was shocking. It's shocking to him how I take care of, he comes to me now and he compares, and he thinks I'm doing something special for him because he's my friend, but actually I do the same thing. I take his calls. He had this terrible pain this week. We arranged a test immediately. He had the test done. He had the answer in his hand within minutes.
Outstanding, right.
And he thought it's special treatment.
Yeah, VIP treatment.
But I try to give everyone the report, and that's the other thing. Many patients come to us and they don't have any reports. Their doctors never give them a report, the pathology or the CAT scan or the PET scan or the MRI. So they come and they have nothing in their possession. And a patient comes to me, we call and get those reports, and we give a copy to the patient. So they have it in their hand and they read it. And it's incredible. A patient and their family will take that report and they'll read it. They'll read every word.
Sure.
They devour that thing, and they'll ask, what does this mean? And what does that mean? And what does this mean? And, so they understand what disease they have and what they're facing. And I just find it, personally, I find it incredible that patients are people. People have illnesses, and they don't even have documentation of what they have.
Yeah.
So, and it's obviously something that person has. It's part of their history. You know, their family may want to know, their children may want to know, their loved ones may want to know what does Dad have, or what does Mom have, or what does Johnny have.
Sure.
So there's many things that we do that are different, and a lot of the things are just subtle little things, like
right, that make a big
answering
difference.
a phone call.
Yeah. Now, let me ask you, Doctor, if a listener doesn't have a chance to call in this morning and wants to reach you over the weekend, and they call 212 Choices, will they speak to a receptionist or?
No, they get me. The phone lines go to me.
Wonderful. So that's back to being there for the patient.
Right now, I may be. Let's say I'm taking a shower.
Yeah, well, I'm sure that's understandable.
So if I'm taking a shower, I should call back in 20 minutes.
Yeah, okay, good. I wasn't sure about that.
There's a few things I'm doing that I can't exactly answer the phone.
That's fair enough.
But usually, or if I'm in a subway, if I'm going from point A to point B in Manhattan, and the phones don't work down there, they call back, or they can leave a message. Right,
that's good to know, because I'm sure some listeners have an afterthought. Maybe they want to reach out to you. I have a question, so.
There was a very interesting man. It was kind of like, it'd be headline news. It was 1973 in Watergate. This would be like the smoking gun.
Yeah, sure.
Do you remember anything about Watergate and
the
smoking gun? And the smoking gun is when they found irrefutable evidence that something bad happened. Right, that's the smoking gun. So this week I found the smoking gun. And it was incredible. This man came. It's a true story. Everything I tell is a true story here. He's 43 years old. He came with his fiancée, beautiful woman, really bubbly with life.
Right.
And he's 43. He has prostate cancer. He hasn't had treatment for a year and a half. He's had 0 treatment.
Okay.
He came and saw me last summer, and we spoke about all the options. He chose not to be treated, and he's shopped around. He shopped around, like a lot of people do, and we always encourage people to shop as long as they wish, as long as it doesn't hurt them.
Yeah.
There's some studies, this is a black man, there's some studies that in the black community, a delay in treatment ends up hurting the patient. And with breast cancer and prostate cancer, some people wait so long. Actually, in the black community, prostate cancer mortality, which means death from prostate cancer, is 200% higher than the white community. And it's mainly due to delay.
Yeah, sure.
So, you should shop around, but on the other hand, you shouldn't shop until it harms you. So this man came in. He had a PSA 5 prostate cancer, Gleason 6. And he's shopping around, and he saw doctors at a big cancer hospital not far away. He was interested in robotic surgery. Now, we've spoken a little bit about robotic surgery in the past.
Yep.
Robotic surgery is the Da Vinci machine. So the patient's in the operating room and the patient's asleep. The doctor sits somewhere else. It could be around the world or in the next room or next door with a machine that has like gloves. And the doctor puts his hands in the gloves, and whatever the doctor's hands do, the machine
mimics.
Yeah. So at the National Cancer Meetings in Atlanta last month, people called it not robotic surgery because it's not a robot that's really doing it.
Right.
Puppet
surgery. Yeah.
Because your hands are in the gloves and they're moving around and they're imitating you like a puppet. Your hand opens up and the puppet opens up. Your hands close and the puppet close, right? So, and a lot of people think, wow, robotic is, like space age. It's a super miracle.
Sure.
You've got lights.
Sounds fancy.
You got lights and you're operating and it has these puppet therapy and they have lights, and you're supposed to see the nerves and see the blood vessels, so there's better results. And patients are being led to believe, it seems like falsely led to believe, that the results are better. Now, there's one website in New York about a doctor who does a lot of puppet therapy, or robotic therapy, whichever name you want to call it. He says he's done thousands of cases, and he claims a 97% cure rate. Now, there's an asterisk on that. I don't know what the asterisk means. It's hard to find the other end of the asterisk.
Sure.
It says 96% of patients regain continence, which means I don't know how many people lose urinary control.
Sure.
85% of patients regain sexual function, and always operating with the same team. So that's what he's claiming. But then the government has issued a report, and from Johns Hopkins, a study has shown that the Da Vinci equipment, which has been on the market for a decade, and there's been 1 million procedures, have had thousands of mishaps. And there's been 174 injuries reported and 71 deaths related, according to a study in the Journal for Healthcare Quality. And doctors at Johns Hopkins were able to find many examples of botched surgeries that were not reported. And they concluded that the adverse events, meaning bad outcome, was vastly underreported. Now, if the bad outcomes are vastly underreported, it means when the doctor tells the patient the risks, benefits, and alternatives, he can't really tell them the risk because he doesn't really know because it's not been reported.
Yeah, sure.
So the doctors at Johns Hopkins say that the known reports to the FDA, which is the Food and Drug Administration, the adverse reports only represent the tip of the iceberg of surgical complications and adverse drug reactions. And, quote, the consequence is that little is known of the real disadvantages of the equipment, of the real injuries and deaths it may cause, even as robotic surgery is widely marketed to consumers. Now remember, there's advertising out there that says or suggests, like I just told you, 97% cure rate and everything's hunky-dory and people are regaining their function. But there's another article that came from Harvard that showed of people who had robotic surgery, sexual function remained normal in only 2.3% of men.
Wow. So
if 2.3% remain normal, how many are abnormal?
Just under 98%.
98%.
Yeah.
Okay, and with open surgery, sexual function was normal in 2.9% of men, which means
97% are affected.
Negatively with adverse sexual outcome, which usually means inability to have an erection adequate for intercourse.
Right.
And then about continence. Continence means the ability to control the urine. So from this report from Harvard that actually asked the men, 220 men who had open surgery, what percent had no problem with urinary continence? It was 19% with open surgery, which means 80% had problems with continence if they had open surgery. And with robotic or puppet surgery, only 13% of the 406 men had no problem.
Wow.
So that's another statistic that's telling you that the advertising hype
isn't exactly what it sounds.
Is the opposite.
Yeah, it's the opposite.
Actually, in this study, the headlines were complications no less with robotic versus open prostatectomy. So that's one article that was very important. And then this week, this man, the 43-year-old man, engaged to this beautiful woman, wants to make his life together, and she wants to know what's going to happen to her.
Sure.
Isn't that fair?
That's certainly fair.
You know, she wants to know, she's marrying a 43-year-old guy, is he going to be healthy?
Right.
Is he going to be able to be sexually functional? Is he going to be leaking urine? What's going to happen to him? So he went to this big doctor who's a director of robotic surgery at a big cancer hospital. And he read the report that was written by the doctor for this patient. So this is the head of robotic surgery for prostate cancer at a big cancer hospital. And this is what he wrote. And I've got it in my hand. And if patients want to come in and see me, I will show it to you. But it said, Mr. X was most interested in learning about surgery for prostate cancer, in particular the robotic procedure, period. I explained to him the details of the operation and the anticipated post-operative course, period. I then reviewed the potential short and long-term risks of surgery. These include, but are not limited to, infection, bleeding, positional injuries, deep venous thrombosis, which means blood clot, pulmonary emboli, which means blood clot in the lungs, bowel injuries, rectal injuries, ureteral injuries, cardiac or respiratory problems, shortening of the penis, urethral strictures, incontinence, infertility, and impotence. Now, those are the possible complications of robotic surgery. And then the surgeon goes on. Remember, this surgeon is the head of robotic surgery.
Sure.
A big place.
An established doctor. Sure.
And he said, quote, "Lastly, I explained that while I prefer the robotic approach, comma, there is no convincing study demonstrating clear superiority over either an open or conventional prostatectomy." Wow. Now, if a hospital has to spend millions of dollars and they're advertising this,
right,
and the patient never saw it until he came to my office,
sure.
that the surgeon is saying there's no superiority of one approach over the other approach, then what the heck is going on here? What's going on?
That's certainly
what's going
surprising.
on? It's shocking. It's shocking. We're going to take your calls. We're at WABC. Our phone number is 800-848-9222, 800-848-9222. We're going to hear from our sponsor, the man with the golden voice.
Sounds very familiar, Dr. Lederman.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212 Choices. 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in